So welcome back, Space XPLR channel subscribers, lovers, space enthusiasts, everybody else who are wondering about and on YouTube or in podcast sections and looking for space news and updates and what's happening in the space industry right now. So today we have a very great guest to talk about a very important thing. Again, very close to me. I love just the topic on its own, space medicine. So that's going to be a big topic today. And her name is Hesham Sayed Mohamed. So Aya is a highly motivated medical student interested in space psychology and space medicine, where she looks to combine her medical knowledge with a passion for space innovation. Her experience ranges for authorizing a cross-section study about the correlation between traveling to Mars and personality traits to contribute to many international space projects, such as collapsible lower body negative pressure system, importance of that, and long duration missions and University of California. So Aya has also been a speaker of international conferences in Egypt, Australia, and Mexico. So in addition to her vast activity in the space medicine entrepreneurship, she was nominated as the first space medicine entrepreneur in Egypt. And her quote, I love that, by the way, if you don't find the path, go and create one. So let's keep this today's theme and kind of motivation and encouragement for you guys and girls to go out there and do the things that you want in the space industry. So Aya's dream is to lead an innovative space medicine company and to make space tourism safe and accessible to everyone. So once again, Aya, thank you for your time and looking forward to discussing this space medicine topic.
Thank you. Thanks for having me.
Thank you. So, okay, so let's dive in because for me, like space medicine, just because we're now initiating a company called GRSS, it's a Georgia Research Space Station, an analog station located in Tbilisi, Georgia. Space medicine, again, is out there for us. I mean, personally, I'm not a medical, doctor. I'm not related to medicine in any sort of a way, but it's just very interesting how space medicine is going to be applied or what other innovations are currently happening in the space medicine field. So maybe we can talk about that, about innovations that are currently happening with the space medicine and what benefits are we currently seeing or will be seeing here on the Earth as well because of that.
Well, it's a pretty good question. Thanks for asking. Space medicine is a rapidly growing field, and what actually I like about space medicine that it's not just about providing good health care for the astronauts, but we can apply the new medicines and treatments we are discovering in space to improve our lives here on Earth. And let me give you some examples about the innovations that help the astronauts live better lives in space, and also the innovations that helps us here live better lives here on Earth. And the first is well, let's talk about tumors in space, for instance. So in 2019, Australia researchers simulated microgravity environment here on Earth to see how microgravity will react on the cancer cells or will affect the cancer cells. And the surprise was that 90% of the cancer cells died totally by apoptosis due to the microgravity. And actually, this shifted the way this shifted the medicine into a new way, which is treating cancer patients using microgravity. So imagine that in the future, maybe after 10 years, we will employ the microgravity into the protocol of cancer treatments, or even treating cancer patients using just microgravity. I think it's going to be awesome. So I think it's a great innovation that we are using space exploration to improve our lives here on Earth. Also, let's talk about space robotics. And actually, it's interesting part. And there is a concept called space robotics for a better psychology. So imagine that I am on the surface of Mars, for instance, or Moon, and I'm feeling blue right now. So this space robotic can show for me some recordings about my family and friends, also some recordings about the beautiful views of our planet Earth. and this will greatly improve my mood and my psychology. Also, if this robot has the humanoid intelligent, and this robot can talk to me like a person like me, so I can talk to this robot like he is a therapist or a space or a psychologist, and he will tell me what can I do to overcome this bad mood. Also, we can use space robotics for surgeries. Actually, there was a research and the researchers proved that using robotics for minor surgeries in space will greatly reduce 50% of the time consumed by the astronauts during surgeries. So I think it's going to be awesome, and we need such an innovation, especially in deep space missions. Also, there is interesting examples such as 3D printing for space pharmacy. I like it actually. I'm not as a pharmacist, but imagine that I am on Mars again, and I have some headache, and I need some sort of Panadol, for instance. So, and the existed Panadol right now got expired, for example, and what I need, the only choice for me is I have to wait for the upcoming resupply from Earth to give or to take the Panadol in this resupply mission. So another solution that I think it's crucial to be existed, that 3D printing. Also, I think 3D printing in space pharmacy will help to customize the drugs. In other words, so I will manufacture this specific tablet for this specific person with this specific age and health status and with his psychology and his genetics. So I will manufacture this treatment depending on this person. So I think it will have great effect, and it will, have great impact, and it's going to be crucial, I think, in deep space missions. So I think it's also a great innovation in space medicine.
That's fantastic. I mean, that's some good news and updates you gave us right there. So I want to ask you about the question as we speak about the Panadol, and I'll mention another thing as we're talking about, operations, doing an operation, which is again another big thing. How we solve that in a 1/3, 1/6 of the gravity, right? So, but speaking about the Panadol, and as far as I heard, just because of a microgravity and effects due to that, some certain medicine it doesn't give the same effect as same here being on a planet just because of lack of gravity. So is the space medicine field looking into that currently, how to solve that problem? Because of microgravity, I mean, if you consume this, let's say Panadol, and if you have a headache, it might not work identically the same as it works here on the planet. So is there anything being done like that?
Well, I'm not involved in a space pharmacy research, but what I know is, yes, treatments and medicals in space is greatly differ its effect from here on Earth, and this is due to the pharmacokinetics and pharmacodynamics get greatly affected and changed due to microgravity and also due to radiation. And for us as humans, we greatly change in space. Our blood pressure change, our thermostat also change. Our genetics also change greatly. So to reach the point that we fit the product or we fit the drugs to specific people in space, I think to reach to that point, we need extensive research. We need extensive research on more drugs and on more people in space to reach to that point and to create effective drugs for deep space missions as well.
Yes, I completely agree. So there's more research that has to be done, just plain and simple, right? So talking about operations, I'm currently looking at the image. It's and the company called Virtual Incision. So they developed the first fist size, so about that big, fist size robot in conjunction with NASA that may able to perform abdominal laparoscopical surgery in astronauts. So, and you control that with the joysticks, right? So I'm looking at this image, and you can probably Google, the ones who are watching or listening, virtual incision. That's the company. You will come across this small fist-sized robot that can do the abdominal laparoscopical surgery. So speaking about surgery, what do you think, just with the, again, problem of microgravity, how operations could be performed more effectively?
Well, it's a good question. I think there are more operations need to be done regarding the hygiene. So, and I also think that in the ISS there is a special room that totally sterile, and in this room they can do some minor surgeries. So the first is the hygiene. We need to be totally hygienic in space, because surgery, if it get infected, is going to be so dangerous, I think. Also regarding the human resources as well, the people who can do these surgeries. So we have to train those people better to perform better surgeries in space. But I think such an issue, it's gonna be, some sort, it's not gonna be easy in space tourism field, because to train those people, for me as a person, if I want to pay a ticket to fly next week, how I can, I'm not eligible, or I can't do surgeries or something like so. So how to solve this problem in missions like space tourism missions or so? Also, the microgravity greatly affect the drugs. For instance, if injected, to perform a surgery, I have to take some drugs before the surgery itself.
Right.
And during microgravity, the hemodynamics of these drugs will be greatly different in microgravity. For instance, if I'm injecting the spinal cord here on Earth, so I know that this drug will go to a specific place in the spinal cord.
Right.
But in microgravity, maybe this drug is gonna shift it up toward the brain, so it's gonna be a disaster. So how to control this issue as well? Microgravity affect the movement of the drugs inside our bodies. So we also need extensive research on such point.
So do you think that like nanotechnology could be in some sort of a help in that area, or we just have to work on artificial gravity?
Well, regarding artificial gravity, I have read many papers about artificial gravity, and I found that it doesn't have that great effect to improve or to mitigate the effects of space environment. I don't know, but many papers prove that artificial gravity doesn't have that great effect in mitigating the microgravity effects on our bodies. So I don't know, but everything is possible with technology. 100 years ago, people were dying from diphtheria, for instance. It was like an epidemic. Thousands of people were dying from diphtheria. But we have seen right now diphtheria become a very rare disease due to vaccination. So everything is possible with technology, and with the frequent research and R&D, continuous R&D, we may also found new or discover or innovate new ways other than artificial gravity or nanotechnology. Who knows?
Yes. Okay, very interesting. So you mentioned one word that caught my ear. It was a space tourism, right? And now we speaking with that very openly. I mean, and it's kind of happening right now. We're seeing, Blue Origin is organizing another mission, perhaps in Virgin Galactic, and we see SpaceX with their great missions also. So we have companies going towards that direction, and it feels like this kind of interplanetary tourism might happen very soon too, as well. I mean, we might speak about 20, 30 years from now, but I mean, just in a history timeline, that's very fast. So can we talk about the correlation, as you mentioned before, between traveling to Mars and personality traits? Can you talk about that a little bit?
Yeah, absolutely. Well, I have conducted a cross-sectional study on the people who are interested to travel to Mars, and I have measured some personality traits using Big Five test. It's a psychological test, or like a psychological assessment, and I measured. I wanted to know how those people are thinking and why they are interested to travel to Mars, why they are interested and want to, get very far away from our beautiful planet Earth and maybe live there forever and die there. Why they want to do so, and what are the personality traits of those people. And the results were really interesting. I found that those people are high on openness. Openness means that they are willing to travel new experiences, and this makes sense. And high in openness, high in conscientiousness as well, and low in neuroticism. And neuroticism is the emotional instability. So the neuroticism, the level of neuroticism was very high, means that they are emotionally stable, and this is this is good result actually. And yeah, the importance of this study was to know how those people are thinking. I'm very interested in the psychology of long duration missions. I really want to know how the next generation, Martian generation, looks like, and how what are the infrastructure that we need to create such a generation as well. And I think a lot of decisions that we are taking from now is greatly affected by the psychology of these people. For instance, let's talk about from the beginning, from the selection process itself. So we are gonna select those people depending on specific social skills. So what are the social skills that we are gonna select those people? They have to be, there is an astronaut from the ISS mentioned before that a good sense of humor is really important to decrease the conflicts in the crew, and I think it's really crucial to that the next Martian crew have this trait actually. So what are the social skills? What are the social skills that they will have? Also, if we want to put a conflict resolution program, we will put this program on which base. I think it's also affected by psychology. And if we want to put, for instance, laws for those people, so on which basis as well? I think it's gonna affect by their psychology, by their beliefs, by their backgrounds, by their cultures as well. If we want to put laws for punishing treatments, how this world will looks like, Also, those people are gonna live and get children, and those children are gonna grow up on Mars. So if those youth want to land a job and they live on Mars, how they will do so? I think they will be like a Martian LinkedIn, for instance. I don't know, but it's gonna cool. It's gonna be cool actually. Yeah, so I think there are a lot of questions that need to be answered and need to be more researched to take the decision of putting those people on Mars and creating this functioning society, And this greatly is affected by the psychology. We want to know how those people are thinking, what they like and what they don't like, what works for them and what doesn't work.
Right. Very true. Very true. I agree with it very much, just because the one thing that you talked about, emotional stability. So during these times, obviously, we live in a technology age, and sometimes technology, well, most of the time, technology grows faster than the person can, get caught up to it. And that's what happens. You get a lot of people, and especially, in the United States or other countries, when you get all these labels, ADHD, and all these different letters that they give to the people when they're out of balance, right? So these days, rather than IQ, EQ, emotional, stability, being emotionally intelligent, to make rational decisions, especially anything like that when traveling into space, for 6-7 months. Having that is very important. So as you mentioned before, maybe we should take a bunch of stand-up comedians and put them together, and that could be a good first crew to be on Mars. So at least we will know they will survive the complex situations. So but speaking about that, so what sort of a menu, what sort of proposition do the space medicine experts would give to the people to get more emotionally stable? I mean, is there some sort of a prescription that they would give, 5 times a day, do the yoga, or do, I don't know, meditation, like eat certain food? I mean, how can you get more emotionally stable?
Well, it's an interesting question. There is an astronaut, he came from the ISS, and he mentioned that it was during the COVID-19 period. And, this period was really tough for many of us, being away and being isolated from our families and friends and from our daily life wasn't really easy for many people. So this astronaut advised us, let's say, on how to, mitigate the feeling of isolation and confinement, because, astronauts, they often in this situation, they are isolated for around at least 6 months. So he mentioned that how the astronauts on the ISS deal with this situation and what we can do as well here on Earth. And he actually mentioned many things. And the first is the food. He mentioned that good and delicious food is crucial for a better psychology and for a better mood. When you eat your favorite meal, you feel that you are happy. So it's really important. Also, and also I think there is around 300 different types of food on the ISS, and I think it's really important as well for the astronauts. Yep. Also, they mentioned that we have to exercise. Exercise is really important. Astronauts are exercising around 2 hours per day, and here on Earth, if we exercised, it greatly improve our cardiovascular system and our health and also our psychological health. Also, they mentioned adequate sleep is important. During or on the ISS, astronauts have disrupted circadian rhythm due to the sun. They are experiencing around 15 sunrise and sunset every day. So getting adequate sleep is really important to improve the psychology. Also, he mentioned another interesting something, which is, he said, look at the bright side. So yes, I know that during COVID-19 we were isolated and it wasn't easy for many of us. But if we looked at the bright side, we will see that during the isolation we got a lot of free time. So we've seen many people made the most of this free time by, for instance, reading their favorite books, spending time with their families, doing their favorite activities maybe. So this was the bright side during the COVID-19. For me, I get involved in 2 new projects, space medicine projects during this period, and it was like a great achievement for me. On the ISS, the astronauts as well, yes, I know that they are living in complete danger. Anytime carbon dioxide may leak at any time, for instance. They are away from their families. There is no luxury of life. There is a lot of workload during the ISS. There is a lot of great responsibility, they are representing their nations.
Right.
But if we looked at the bright side, we will find that they are still astronauts. And this is cool,
Right.
I'm
Right.
still an astronaut with all these dangers. Um, I think all of us, when we were asked during when we were young, what you want to be when you get older, we said that I want to be an astronaut. So this is the bright side. So if we looked at the bright side, even at the darkest times, it really improve our psychology, and it really improve our psychological health and improve our mood as well.
Right. Yes, I completely agree with that. Just because, I mean, it's just a proven fact. I mean, scientifically, and just try it on yourself. I mean, in the case where things go down, and it's like, oh my God, I cannot see. Obviously, it's not that easy. Like, for some other maybe people who already been there and they know how to manage that psychological perspective when things go down, that they can click and shift to the better side kind of situation, brighter side. But you can train that. You can train your brain just like to be just like how you can get depressed. There is a certain patterns that you go to that place. And same, you can go to the happiness. There are certain patterns that you can follow and train your brain to go there when you need. So this is very important. I agree with it very, very, very much. So can we talk about, again, long duration missions? We talking about traveling to Mars. Obviously, Moon is not that far. We're traveling to Mars 6-7 months or more, depending on the location of the Mars at that specific time. So how we can prepare for those moments? Obviously, we have analog stations, and we're working on one currently, Georgia Research Space Station, which is going to be holding mainly with a focus of having long duration missions, because we see a lack of presence of that in the current stations. Obviously, they do that, just like Mars 500. There is a great facility that supports long duration missions that prepares next future astronauts and people for long duration flights, or being in a confined environments for a long period of time with the people that you don't like, maybe. So this has to be done. But what other ways people in general, because I don't know if those habitats on a global scale, just a handful, can support 7 billion people. I'm not sure everybody's going to go to Mars, but just, let's say 1 million people supporting the facilities and to train them. So which ways do you see that people can train themselves besides being, in a locked confinement, like with the COVID situation, to take it maybe a little bit more to the kind of extremes level while, being at home? Or I don't know, is there any sort of a different way?
Well, take care of your health. I think it's the most precious advice I can give. Take care of your health, because, let's talk about the astronauts and not the space tourism, because, maybe in the future we see that there is unhealthy people may travel to Mars. So regarding the astronauts, we are selecting the astronauts from, depending on 3 phases. And the first is selection process. Let's talk about it from a psychology perspective. So we are selecting the astronauts based on some psychological assessments, and these assessments consist of two parts. Let's say the first is interviews. So the candidate make initial set of interviews to see if this person is some sort of eligible to travel to Mars or not. And the second part is we are simulating some challenges that this person will face during the flight. And in this phase, the candidate is talking with a psychologist, and the psychologist is observing some parts, or he is trying to observe some points that if this person had those some points, so it's considered disqualifying. Well, and there are many types of the psychological assessments actually, and let's talk first about the type of the study itself. So there are surveys and observational surveys studies that we are doing, conducting surveys with those people to see if they are qualified or not. And the second is the observational, and the observational is we are observing those people. So for instance, if they are involving in if those astronauts are involving in some space mission analog, so we are just, what we are doing is we observe what they are doing in their daily life and what they are acting and reacting to different situations, you know. And also we are doing those surveys and those observational studies by natural or artificial ways. And the natural means that we observe those people without any intervention. And the artificial is we are simulating, as I said, some stressors or some challenges and see how those people will react to those challenges. And you know, let me give you an example. You know, the space psychological assessment is really tough, and most of the people disqualified from the selection process uh, due during the psychological assessment. There is a flight surgeon from ESA, and he mentioned before that they roughly get 1,000 candidates, and those candidates went through the psychological assessment, okay, and only 43 candidates succeed during the psychological assessment and went through the medical assessment. And this truly means that psychology is tough. It's not easy, you know, to succeed in such an assessment. And if you asked me, okay, what are the problems or the disorders that make me as a candidate disqualified, you know? And the answer is, unfortunately, any psychic disorder can make you disqualified. And this is because, you know, wait a second. And this is because, you know, space is really tough. It's not easy. So we have to choose these people being free of any psychological disorders, because the risk of getting any psychological disease in space is really high. So this is regarding the selection process. The second is in flight, during the flight itself, what we are doing. And as I mentioned, we are giving them, you know, some or providing for them some solutions to trying to mitigate the effects of the isolation, like we are giving them delicious food, and delicious and healthy food has whole minerals. Also, we are trying to decrease the work hours load. It's really important as well. Also, regarding or let's talk about missions to Mars, we need to know, it's also still an unanswered question. We need to know what are the you know, the perfect team. Yep. So this team, we have to choose this team from, for instance, one country. So all of them will be from America, for instance. Or it is better to make a diversity in the team, so we can pick someone from China, someone from Egypt, and someone from America, for instance. So right. Which one is better? It's really important to answer these questions.
Yes.
Also, during the mission itself, we are providing for them monitoring with the doctor. So we are trying to improve the telecommunication or telemedicine technology. So in just at any time, if this candidate get any emergency in space, so he can in just few seconds contact with the doctor on the ground to get an online consultation in just few seconds, you know. Let's talk also about post mission, you know. So because space is really hard, those candidates may get some psychological, you know, diseases or disorders. Let's say maybe they can get some anxiety, they may get depression as well, especially when we talked long durations, like durations for 4 years. So it greatly increased the risk of getting depression after the flight or after the mission.
Right.
Also, this may create or increase the risk of getting some marital problems, and in this case, they need to talk to a psychologist. So we have to, make sure that everything is stable pre, during, and post flight to mitigate the effects of the space environment and the mission itself, because space is hard, and especially during for the long duration missions like spending 3 or 4 years. So how to make sure that those crew members will spend 4 years together without killing each other, without
Yes.
killing each other, and
Yeah.
come back safe to Earth. So yeah.
Exactly, indeed, indeed. Those are very, very great insights and perspectives that you give us right now. So I really appreciate it for sharing that. I want to ask you, so on top of that, while we still speak about space tourism and with the first crew missions, I do understand, obviously, those are going to be vetted professional astronauts who've been going on more than a few probably missions on ISS before, so those crews are going to be fine. The first ones is fine. But as we're currently talking about the space tourism kind of situation, and we see that on a commercial side happening right now, and you probably came in even across Orbital Assembly Corporation, who are looking to build a gateway in orbit hotel. You probably see that also, maybe I don't know, but that's also like, it looks like it will be happening at some point. A hotel in orbit. That's a cool idea. And again, traveling into space. I mean, traveling to Mars for 7+ months and then staying there in this confined environment with the people that you probably, of course, met. You trained with them together, but for the commercial space, I mean, what sort of a way we can look into that? Because obviously some of the companies, they will be looking to monetize that and make it as a service, right? Either flying to the hotel, staying at a hotel, flying to Mars, coming back. That will become some sort of a service. We might say, okay, 100 years from now, okay? So how we can actually look at that situation with having that, okay, we have to mitigate the risk of that psychological problem that might occur during the flight or just while staying on Mars or Mars or in the hotel, right? So as you spoke about, is that you're going to be certain training that will still apply to every individual before flight? Or it has to be, as you mentioned, again, robotics, some sort of a AI technology. They have to intervene with that person, one-to-one or either in the group conversation and mitigate the risk of a conflict or whatever problem might occur.
Well, thanks for asking these questions. It's my favorite part, actually. First of all, I do believe in space tourism, but frankly, it's a price issue right now. Many people cannot afford the price of the ticket right now. But with the continuous research and the improvement of technology, I believe that at least 10 years from now, the situation will be completely different. And you're gonna find many people traveling to space, maybe just for experiencing the overview effect and see our beautiful Earth from above, or we will see researchers traveling to doing scientific experiments for R&D purposes, or also we will find patients who are traveling to space to experience the microgravity, because microgravity can be used as a treatment for many diseases. And it's like a power that we cannot find here on Earth. So we are gonna, in the future, we are gonna find many people are traveling to space. I believe that. Let's talk about that from a medical perspective. We get used that if there's someone want to travel to space, he has to be for the astronauts. He has to be fully healthy, free of any psychic or medical disorders. But regarding space tourism, the situation is completely different. For me, I want to buy for a ticket to fly next week. So how can do this? I don't have to get a lot of medical, psychological, and technical training to travel space. I don't need all this. I just want to experience the overview effect.
Right.
So how can we do this? Well, currently, let I want to tell you that it is possible. It is possible to fly unhealthy people to space as long as their medical condition is stable. In other words, let's take an example. So if this person has some coronary artery disease, so what we can do for him, we can optimize the medical management for him and control his hypertension or control his tension level and make sure that his medical condition is stable. Then he can fly to space. For instance, if this person has high risk of thrombosis, so what we can do for him, we can give him low dose heparin by injection pre and during the flight, and make sure that his thromboembolism level is stable, and monitor his I'm going to talk about this later. Okay, and then make sure that his medical condition is stable, then he can fly to space safely. For instance, if this person has some psychological disorder, well, we have to make sure that this psychic disease will not make this person harm himself or harm the others around. This is the most important thing. So making sure that his psychic disease or psychological level is stable at some level, and then he can fly to space safely. Also, we can improve the telecommunication or telemedicine technologies. So even if at any time any one of those space participants get some medical disorders, suddenly they can in just a few seconds contact with the doctor on the ground and get online consultation. So it's crucial as well. Also, we can fly a doctor simply with the crew. Maybe SpaceX can choose me to fly with one of its missions. It's gonna be cool. And I'm gonna take care of those tourists. So flying a doctor with the mission is another solution as well. For instance, if this woman is pregnant, okay, so we prefer currently that we delay or postpone the flight till she get delivered her baby, and this is because we don't have so much information about how space and how microgravity affect the pregnant woman, and is it really safe to fly pregnant woman to space or not. So currently it is possible, it's still possible as long as the medical condition is stable and will not be complicated in space. This is the most important thing. And I think the future is optimistic with the continuous research and the development of technology. I believe we will see that or we will see more people with more serious medical conditions are flying to space safely due to technology.
Right. Very much agree. So this is still R&D, and it will continue to be even probably after 100 years, because it's a nonstop process, and we need to gain the momentum, which already feels like we're gaining that momentum, and we get more and more private commercial industries coming in, and they're working on that R&D process within the space agencies out there, and making things that we speak about happening in the near future. So speaking about some other problems, so let's say because of the microgravity, again, speaking about Mars, that's a long travel, right? That's a long travel, 7-9 months, plus. So that means even if we're going to spend there, let's say on Mars, 1/3 of the gravity for, let's say, a week, for first crew, right? They'll still will have to come back, which means another 7-9 months. So, I mean, the longest mission so far in ISS, I think it's been like 375 days or around 400 days, right? With, I think, Russian astronauts or something like that. So that has not been experienced so far. I mean, 18 months plus, I mean, 20 months. So, you know, a year and a half kind of, you know, situation. So again, problems might occur. So any problems, again, from a, you know, a physiological side, kind of with the kidney stones, osteoporosis, or, you know, what else? So like muscle atrophy and things like that. So can we speak about, again, another part that I know it's been mentioned in your bio, which is lower body negative pressure system. It's called LBNP. So can you talk about that system? What does it do? And does it actually help us to tackle or to find some research for those, you know, physiological problems that might occur during the space travel?
Yes, absolutely. Well, when we are in space, we are experiencing microgravity, you know, there is no gravity in space. So our fluids, okay, let's talk about Earth at first. So when we are on Earth, gravity pulls down the fluids into our legs and into our lower limbs. But when we are in space, there is no gravity. So all of the fluids, including the blood and lymphatics, shifted up towards our head and towards our upper limbs, and this creates serious complications. Actually, it can increase intracranial tension, and it affects the visual acuity, affect our CNS, it also compress many parts inside our brains, so it's really dangerous, you know. What lower body negative pressure do is it create like a gravitational stress in our lower limbs. So it pulls down again the fluids toward our lower limbs and toward our legs. So it greatly mitigates the effect of microgravity when we are in space. And actually, astronauts are frequently using lower body negative pressure on the ISS. And there are many studies been done on such a device, and they found they proved that it greatly mitigates the effects of microgravity and the effects of, you know, the shifting of our fluids into our upper limbs. But the problem is this device has many or some limitations, you know, and one of them is we don't really know how this device will affect the people who the space tourists, not the astronauts, the people who may have some medical disorders, you know. How this device will affect these people, is it really will be effective for them or not? We don't really know. Also, we don't really know if this device will be effective for long duration missions or not, you know. I don't know what is the maximum or what is the longest duration this device been used, but I think it hasn't been tested before for around 4 years, for instance. So we really want to know if we want to travel to Mars for around 3 years, for instance. So using this device will be effective or not for such a long duration. And also using such a device will have some adverse effects on the long term or not. We also want to understand this part. Also, the lower body negative pressure decrease the endothelial stress or the endothelial vessel stress. Okay, till now we don't really how this mechanism happen. So it is also considered a limitation. So this has some limitations, and we're talking about space tourism. We don't really know if we use this device with space participants, this will, you know, be effective for them or not, and will be effective for such unhealthy people or not.
Mm-hmm. Right. Okay, very interesting. So another problem. So let's speak about another problem which currently we're facing right now on the International Space Station, and that's probably one of the reasons. Obviously, microgravity is being one of other main reasons why astronauts have to come back to Earth, and they have those brand new crews changing over time. So obviously microgravity and radiation. So can we talk about how do you think radiation and radiation sickness over long periods of space travel could be treated? I mean, are we talking about the medicine or protecting the spacecraft better? I mean, what's the solutions are out there?
Well, it's an interesting question. I think, right, yeah, radiation is really serious problem. You know, on the ISS, astronauts are exposed to radiation for around the same amount of radiation they get equal the same amount the normal person here on Earth get in 1 year, I think. So they exposed to a very big amount of radiation. Actually, right now, what I know about this is we can use, you know, the vehicle itself will protect us or will work as a radiation shielding and protect us from radiation. Also, building lunar or Martian habitats will play a great role in mitigating the effect of radiation. Also, the spacesuit itself is crucial, you know, especially in the extravesicular activities, it has a great role in decreasing the effect of radiation. I think I have read before an article, but I really can't remember it well, that we can use also medicine or, you know, drugs to decrease the level or to decrease the danger of radiation on our bodies. So this, I think, if there is something is get innovated or existed, especially in the deep space missions, it's gonna be crucial as well, because, you know, radiation is still a serious problem, and yeah, it needs more research. And currently we found some private companies that are working just on this problem, on decrease the danger of radiation during space exploration. So yeah.
Right. So speaking about the private companies, you actually been nominated as the first space medicine entrepreneur in Egypt. And again, as one of your goals has been stated in your bio, was about to create an innovative space medicine company and to make space tourism safe and accessible for everyone. So can you speak about that, your personal future goals with the company, and what do you envision, you know, in the near future?
Well, yeah, thanks for asking this. Actually, I truly interested in business, especially space business. And as I mentioned, space tourism has great potential. So, and for me, with a medical background, I was thinking about working on a common problem between space tourism and medicine as well. Mm-hmm. Yeah, and regarding the code itself, you know, in my country, let's say, we don't have a strong human space flight program. Okay, so for me, it was like 3 years ago when I just decided that I want to, okay, I'm gonna work on the space industry. It wasn't really easy for me to get involved in some space medicine researchers. There wasn't a lot of available opportunities for me. So I started to work on space medicine researchers, and then I currently I became interested in space entrepreneurship, and I'm working on that company right now, but we haven't launched it yet. So stay tuned. There is interesting something upcoming. So actually, I have learned a lot during my journey. You know, the idea of creating opportunities from scratch was really challenging for me. So, and I remember when I have decided, okay, I will work in the space medicine industry, I dedicated myself for around 5 months learning and reading about space medicine, reading a lot of articles and books about space medicine, checking NASA website, seeing what they are working on and what they are interested, what are the projects that they are working on right now. So anyone, my advice for anyone like my same situation, if he live in a country that doesn't have a space program or so, my first advice is educate yourself, you know.
Yep.
It is really crucial. Don't wait for the perfect time to get involved in a space degree like a bachelor or a master degree. Don't wait for that moment. Elon Musk doesn't have an aerospace degree, so educate yourself. Everything is on the internet, you know.
Yep.
Just read and master the specialization that you are in. For instance, if you are an engineer, so master the engineering at first, and then shift to the space industry. This is the first advice. And the second advice, actually, I have learned throughout my career in the space industry, is make mistakes. You know, I have did a lot of mistakes throughout my journey, and on the other hand, I have achieved great successes as well. And I bet you that you learn it from your failures and your mistakes more than your successes and your good days. So it's really crucial to make mistakes. It's okay. We are humans. Don't be afraid to get rejected from a project or from a company, or from that project. It's okay. It's okay. We are humans. So love your failures, make a lot of mistakes, and just go for it. Yeah, if you found that something you are interested to do and you want badly to do it, go for it. Why not? Life is too short.
Exactly. So I agree with everything that you just said, because obviously space industry is taking off right now, and there's many opportunities. And in my eyes, it's all about, and probably some of the people who will be hearing this right now probably say, oh, not that again. But for me personally, it's all about compressing the timelines, and for that means we need more people to get involved. And again, during these days, I mean, we can consume information in different ways. And again, living in an informational age, everything is out there, as you mentioned, on internet, on YouTube, or on blogs that other people posted who've been working at NASA or GPL or the space agency. They're posting blogs, updates, what's happening. So again, look, everything is at your fingertips. So, I mean, information is out there. So the question is just finding the direction and discovering things that you want to do and following that. And again, through the time, as I mentioned, through the failures, which, in my case, I still continue to do. But look, that's just life, right? You just gonna brush it off. It's bigger failure, smaller failure, but then at the end of the day, you're moving further. You're moving further, and things are going, into the future. So look, again, I appreciate you coming on today. It's been really a blast talking with you. I mean, there's a lot of great insights that I discovered today personally about space medicine field, any innovations that's currently happening. I mean, it's really awesome. So again, I appreciate you sharing all of that.
Thank you so much. I really enjoyed our conversation. It was so fun time. Thank you. Thanks for having me.
Thank you. No problem. So look, guys and girls, before we're going to take off, I want to ask you a last piece of help, because during these times, I mean, we need more people to get involved in the space industry. We continue to need to move that needle and, to get the momentum going. So if you pass this episode to your friends, share a link if you're listening to that on a podcast, or just share the video if you're watching this on YouTube, and send it to your friend and say, hey, look, have you know about the space medicine? This is actually existing, and these are the innovations that are currently happening. So if you do that, I really appreciate it. So, and besides that, until, I appreciate you watching or listening, and I'll see you and talk to you very soon.